I looked at your health care proposal in your Plan for America. There's a line in there about people. It's very artful. It's like people will have the responsibility to get their own health care or whatever. That sounds like a mandate that you work toward a mandate where everybody has to be covered.
Yeah.
And then beyond that mandate, we now have a situation where some people can't be covered, so I'm assuming you're going to require the insurance companies to insure people.
You mean like pre-existing condition?
Yeah.
Yeah, yeah, absolutely.
This state has
absolutely.
That. So then then there's this situation of, sure, we'll cover you, but it'll cost you $1,000 a week. Does the federal government step in there? How does that work?
Well, I'm going to give you my health care plan, in 5 minutes.
Take 6.
The other day I said I'd do it in 4 and it went into 8, so I'll do
We got 28 minutes and 36 seconds.
I'm not rushing. I'm conscious of your time. You know why? Because I want your endorsement. Don't think I'm here just to be nice to you. I'd like your votes, but I'm here. I would be honored to have the paper's endorsement. Anyway, let me get off of that. Is that on the camera? This is what I would do. The first problem I would try to fix with our healthcare system is this one. We spend $2.2 trillion on healthcare in this country. It's 20% of our GDP. Yet life expectancy, disease management, we're below any other country. Here's the biggest problem. 1/3 of that $2.2 trillion is administration. It's inefficiency. It's lack of electronic record keeping. It's waste. It doesn't go into direct care. It doesn't go into diabetes or cancer prevention. So the first step, before you get all these people with new ideas on healthcare that they want to either tax you or create new bureaucracies, is fix that problem of putting that 1/3 into direct care. And that means prevention. That means electronic records. That means saying to insurance companies, 85% of your premium should go to direct care. And then secondly, I think you take other sensible steps. We got 47 million uninsured. We got 17 million underinsured. We got several million with pre-existing condition. But under my plan, if any of you have a health care plan and you like it, I won't mess with you. You're happy with yours. I'm not going to make you take Medicare. But I'll focus on those that are uninsured, that are underinsured, that have problems. The vet system. Now, these are the steps that I take. One, you know who has the best plan in the country? Judd and Sununu, the Congress. Why shouldn't you be part of that? You have to pay for it, but small business individuals be eligible for that plan. Secondly, I'd lower Medicare to 55. Today it's 65 and over. Make more people eligible. That I think helps with preventive services. More people earlier get preventive services that Medicare offers. Third, veterans. I don't know what your nearest VA hospital is here. What is
White River Junction?
White River.
How far is that?
A little over an hour.
Yeah, you'd get a World War II vet. It's hard for them to get there. Vietnam, Why can't we have... I would give every veteran a Heroes Health Card so that they can get health care, where? Anywhere they want. Get them right here in the hospital. You have one, right?
Oh, yeah.
Yeah, get it here. Why not? That's inefficiency, but I think you also have to fully guarantee the VA system, especially in mental health. We get our kids coming back, young people in the war, they got PTSD, they've got trauma, so we got to treat mental health better. But you asked that question: is it Pat or Patrick?
Guy.
Oh, who's Pat?
Everybody gets that wrong. It sounds so much like Guy.
No, wait a minute. Who told me? Where's Alex? Didn't you tell me it was Pat? Jesus Christ, I'm going to lose this guy.
No.
Got his name wrong.
Guy is easy. It's easy.
All right, well, sorry.
That's okay.
Call him Pat. You guys going to call him Pat from now on?
Well,
Right, we might.
maybe we just change.
We'll have some fun with it.
Okay, so what I would also do is, mine is a mandate, but I would also focus on prevention, which we don't do in this country.
Mm-hmm.
And that means, what I did in my state. I could, by executive order, I banned junk food in schools. We're going to do that nationally. We ought to have mandatory physical education in schools. Healthy breakfast for every child. We don't do that.
Get the sugar out of coffee.
Yeah. I mean, here I'd give the paper an incentive, a tax incentive, if all their workers were encouraged to get healthier or work out or whatever. I would have smoking bans nationally. I would basically be a nation of research. Why we only spend $6 billion a year in cancer research, which is far less than any industrialized country proportionately. That's 2 weeks of the Iraq War. I mean, that's our senseless priorities. Alzheimer's, we don't spend enough on that. We don't spend enough on heart disease.
Some of this is already going on. I have had some medical problems, and I get calls from my insurer. They got nurses that call me up and ask me how I'm doing and tell me to eat peanut butter for breakfast and things like this. So this is going on to some extent. But the problem that I see, or not the problem, but the element to the equation that you just laid out is how we're going to pay for it. We just talked about Medicare is in some serious problems, and you're talking about expanding it by 10 years to put more people on it. That would allow people to retire earlier. It would help people who are unemployed because maybe they don't get employment through their employer, don't get insurance. But we have to come up with the money for that, wouldn't we?
Yeah,
while you're cutting the costs on the other end.
I'll leave, Alex will leave with you. Every plan that I ever talk about, I find a way to pay for it. My education plan, my health care plan. Here's, you pay for it through savings. $50 million if you have, $50 billion if you have more prevention. $22 billion if you have electronic records. The war is costing $500 billion. Presumably that money can be spent on discretionary programs. The Bush tax cuts, although I'm a tax cutter, I think the 2% for the wealthy, that they didn't even want it. This Bush wanted it. I would repeal that. I would, there's $73 billion worth of corporate welfare. Every special interest has some little deal. I'd get rid of that. I'd get rid of earmarks. Judd will hate that, but you know what? These earmarks, they don't go through transparency. You get stuck with these 250 million bridges to nowhere. People say, well, why didn't they repair that bridge in Minneapolis that went down and killed people? Because we had earmarks. They were all going to New Hampshire. No, I'm kidding.
Iowa.
Yeah, for New Mexico too. We had Senator Domenici. He's the king of earmarks. We just ought to get rid of it. We ought to have more transparent process. That's how you pay for it, Guy. See, I got it right.
That's good.